Welcome everyone, this is Yasser Wasifi from Learn Dental series. In this episode, we will continue our discussion about Introduction to Dental Practice Management. First, I would like to declare that I have no financial disclosure or conflicts of interest with any of the presented material. Also, I would like to announce that this presentation is copyright protected and could not be transmitted by any means unless you get a prior permission from the author. By the end of this presentation, you are expected to be able to compare the different dentistry career options and also able to define and recognize the importance of practice management in dentistry. Let us start with dental career options. Before starting our detailed discussion about dental career options, I would like to ask you an important question, and please try to take your time for thinking about this question before you are replying to it. Okay, even after we finished our discussion, try to think more and more about this question. My question is, those are three creatures. What is the difference between them? If you imagine those three creatures are dentists, what are the difference? What they could introduce for dental health care for a patient? How could they deal with your patient? Okay, if you think deeply, you will discover something. Parrot and monkeys are considered as imitators, while this dentist, as being a human being first before he is a dentist, is innovator. Those are imitating, but this one is acting. What is the difference? Parrots imitating and repeating what you had said to them. Then they are repeating your speech, okay, without understanding what is the meaning of it, without differentiating the language. If you train your parrot, okay, to repeat a statement in English, it will repeat it without understanding that this is English or what does it mean. The same if you train it to repeat a statement in Arabic or in Indian or whatever the language, it will repeat it exactly the same without understanding what's the type or differentiating what's this language, okay, or without even understanding the meaning. The same for monkeys, but instead of imitating sound, they are imitating your physical movement, also without understanding what is the importance of this movement and what is the risk of this movement. Okay. Also, they follow the instructions exactly, but if you change the language or if you change the sequence of your instructions, maybe they get confused and could not follow it. If you ask the parrot, okay, to tell a patient post-operative instructions for after extraction, okay, and say to it, okay, uh, tell him the post-operative instruction, okay, he will repeat it because he accustomed to listen the order in this sequence. Tell him the post-operative instruction. Okay, if you change the sequence of your words, okay, or instruct him in a different way, give him instructions. Okay, if you have a human being assistant, okay, he could understand, he could integrate whatever the language you ordered him or instructed him, you could know what you are asking about. The same for monkeys. If you train a monkey to prepare a cavity, okay, cavity preparation with definite widths, tips, extensions, okay, you couldn't recognize the other environmental condition or the other systemic and other dental condition of the oral cavity of the patient. That's why it couldn't modify the cavity preparation. He is imitating. But the dentist, having a mind, okay, having knowledge, listen to the patient during history, examining the patient and collecting data. He already integrating all of these, melting them in a crucible, which is his mind, to understand what is the patient problem exactly, what is the predisposing factor, what is the etiological factors, what is the environmental factor, including oral and para-oral factors related to the problem, and that's why he could design an exact, perfect treatment plan that is considered as the most suitable one for this case or for this patient. This is the difference. That's why when we consider dentistry career, we should first discuss what are the core competencies required from dentist. Before 20 years ago, the competencies required from dentist, GP, or specialist or consultant all are focusing on the treatments, preparing cavities, cutting cavities, okay, with minimal risk to you as a dentist and to your patients, okay, at the same time extracting these safely with the least complications, expected complications, constructing prostheses, and so on. All of these are manual dexterity, okay? But now we are in the 21st century. There is other activities that are required as competences from dentists. That's why most of dental schools changed all their aims and they changed their expected outcomes from their programs, either undergraduate, postgraduate, continuous education. Because there is another requirements for this century, another demands for your patients, okay? And it is not considered as optional requirements, it is now a mandatory one. Let us go for what has been stated by the American Dental Education Association, okay? What a career in dentistry demands. A career in dentistry now demands 12 competences that you should have to be a dentist. Even if you are an old graduate, okay, you should train yourself to get these competences by a way or another, okay? That's why the market for continuous education and the continuous education providers increased in the field of dentistry, okay, in an unimaginable number, either online or live sessions, workshops with hands-on, okay? But what is most important is not to focus on manual dexterities only, okay? Including practice management, communication, IT. Actually, our digital era is introduced to the market. Now we are in the era of digital dentistry and how to use artificial intelligence in dentistry, okay, including diagnosis, imaging, treatment planning, designing a restoration, okay, and you don't know tomorrow what you get more else. That's why, okay, those 12 competences are: number one, good judgment, organization, critical thinking skills, professionalism, negotiation skills, networking skills, and manual dexterity. It is not the first one, okay? Then coming continuous education, leadership, community service, research, building relations. About 9 of them are focusing on personality. Research, community services, manual dexterities, okay, are much more related to your scientific scientific portion of your life, okay? What's meant by those 12 competencies. Number 1, good judgment. Exercising good judgment means exhibiting humility. Accept that you don't know everything. And when you make a mistake, for example, in choosing a staff member that is not the right fit for your patient or practice, learn from it by correcting it. It is not run in a friendly pattern. It is run in a professional pattern. Okay? It reflecting on how you would handle it differently in the future and then move on. Then your first concern now is your patient. That's why you should have good judgment. Then coming organization. Being organized is a skill that's important in every aspect of your life. Especially now, life is not simple as before, and particularly so in your career. When you have established a clear set of goals, okay, for yourself and your business, you are less stressed, more productive, and most importantly, you have the time to focus in providing quality care to your patients. This is the meaning of organization. Organization not about your schedule, not about arranging your tools or arranging your stuff. It's about setting goals, setting time for achieving these goals, focusing on quality of care you are providing to your patients. Then, what is most important is the critical thinking. What is meant by critical thinking? It is the art of using reason to analyze ideas and dig deeper to get to our true potentials. Not only taking your information from your patient without integrating them. You should go deeper to ask the patient about much more related items related to his illness. Okay? That's why critical thinking isn't about thinking more or harder. It is about thinking smarter and better. It requires discipline, motivation, and the ability to take an honest look at a particular situation, even when faced with an uncomfortable reality. You should go deeper and deeper, ask more and more until you could integrate and analyze the knowledge to get the better solution for any problem. That's why it is about questioning your assumptions, adjusting your perspectives, and understanding your own bias. It is also about putting yourself in other people's shoes. This is important. Before you are dealing with a patient, okay, put yourself in his shoes. And this is the major factor that leads to success when you are communicating with the people. Understanding all of your options and being willing to fail until you succeed. Okay, this is an important issue in critical thinking. As a dentist dedicated to improving the level of oral health care available to your patients and all of society, critical thinking is an important skill to process. You couldn't perform a good health care without you have critical thinking skills. It is not about the intelligence difference or IQ difference between a patient and other. You could train how to integrate and analyze your data to get a proper solution. That's why you could use the knowledge. That's why most of dental programs, dental courses are focusing on not to have the knowledge, but how to use the knowledge. What is useful if you have, say, 1,000 knowledge and you don't use or even know how to use even one? But a smarter dentist who focused on the knowledge in his career, in his specialty, and focusing on how to use it, it's a qualitative performance rather than quantitative performance. Then comes professionalism. Professionalism, maintaining a professional persona is critical to becoming a successful dentist. You must be competent, reliable, honest, accountable for your actions, and be able to remain cool and calm under pressure. Again, able to remain cool and calm under pressure. Okay? Then coming number 5, negotiation skills. Being a skilled negotiator is critical in most professions, and dentistry is no different than these professions. Whether it is managing expectations around employee salaries or discussing fees with insurance companies, being an active listener, maintaining emotional control, and upholding your ethics are vital according to your religion and according to your faith, okay, and according to your attitude, okay. That are vital to successfully negotiating any situation. Negotiation skills should run parallel to your beliefs and your ethics. Okay? Then coming networking skills. Networking skills now is an important issue in building up your reputation, credibility, and ultimately your client base and practice. Dentists must be comfortable engaging in different networking opportunities and situations, keeping in mind that the most effective networking is not solely about you and your needs, it is about your patient and their needs. Okay, that's why the best advertising, and we will discuss it in the coming topics, okay, coming chapters or sections, okay. The best advertising now is considered as using the social media, but for social media you don't have or you shouldn't have to write about yourself. You should let a great chance for your people, your friends, your patients, which are the most important ones, okay, to write about you, to write about your clinic, your treatments. But don't forget to violate any dental ethical rules. Nowadays, it's common to see a dentist who already published his work or his treatments in a form of or in terms of photographs before and after, okay. But did they think that they had informed consent from the patient before this? Photography, remember that photography, because it is a basic constituent of all networking media and platforms and networking skills, okay. Photography is a critical ethical issue. Even if you are using it inside your clinic for treatment planning purposes, but you should ethically have an informed consent from the patient. He agrees you to photograph it. Suppose you have, in our culture, suppose you have patient, especially female ones, who refused to be photographed. You should convince her. You should show her cases, okay, that denotes how much photography is important. You should show her examples for this. Surely she will be convinced immediately and she will agree about photography. But if you are publishing it in a social media, this item should be included in your consent. Otherwise, you will be in troubles. Let us go back for social networking. Successful networking involving asking someone else what they need and connecting them with someone you know and trust. You should ask the patients, okay? If you had seen different treatments available online, or if you are Googling about your problem, and he will indirectly direct you to the way you will use social media or networking for your credibility. Okay? Most important, networking is about giving first without the expectation of something in return. What I am doing now is considered as networking skills. I'm using YouTube to spread my work in dental education, including my specialty operative dentistry or this course or what is upcoming next, I don't know. Okay, this is networking skills. When I was firstly joining the career of faculties, okay, I couldn't imagine that a day could come and I will publish my lectures, okay, by this way using YouTube online, and it will be available for a varieties of dentists or a varieties of people or a varieties of students, okay, in different geographic locations, okay, joining different dental schools by this way, even using PowerPoint or Keynote. Okay, I couldn't imagine this because I am from the generation that had been taught using a chalk and blackboard, followed by using markers. And it was an amazing innovation when our doctors or our educators used whiteboard with colored markers, because our tradition and our background is only white chalk on blackboard or green board. That's it. And all changes, and as we discussed before, you should be ready to change, and you should expect a change. Also, if you remember, okay, the terminology of new norms. What is the new norms? This terminology arises after the pandemic of COVID-19. Okay, because now the basic is online teaching rather than face to face. Online teaching, it was like before, like this pandemic, before, just like when you couldn't have enough time for discussing a topic with your student, okay, just use it for emergency. If you need an extra time or paracurricular activity. But now it is considered as a basic component in your teaching style or educational process. Then finally comes manual dexterity. Number 7, which before was number 1. Okay, manual dexterity means superior eye-hand coordination. This is the only aim of it. Superior to superior eye-hand coordination. As a dentist, okay, and it is critical to ensuring the safety of your patient and integrity of the profession. That's it. Eye-hand coordination and ensures a high level of safety and risk reduction when using these equipment. That's it. And it depends also on practice makes perfect. Okay, it is not a big deal that you couldn't prepare a perfect cavity. Train and train and train, and you could get a higher level of repairing cavities, okay, with high efficiency. It's terms of training, okay. Then comes Then, what about community service? It's by default. We are healthcare providers. Okay, then our basic service is a community service. It's a service that focused your profession. Okay, it's our focus. Our focus is community in all health services, because without community you are nothing. All your treatments are to improve the health of the community. That's why you should have enough skills how to provide a community service in your dental field. Now many dental schools include community service program. Their mission statement, okay, also includes this community service. Already you are treating patients, these patients are from your community, okay? Also, you should also search for providing your community with dental education as a preventive mean and to solve your community problems. Okay? There are endless options for community service work. Not only when you are undergraduate, but also when you are postgraduate, you should focus in community service. Okay? You could find any project that fulfills you and motivates you to continue your work in the community. Community service, as being a GB, is not only to provide dental education or to provide dental services. You could join any community service, charity programs, okay? You could join any type of club activities, not athletic activity, okay, that provides community service. And through this, you could introduce yourself, okay, as being a dentist. And through this, you are communicating much more with your community, and it will let you to focus exactly what is the need of your community and the population, what they demanding from dentists. This is the thermometer activity that let you to measure your community and your population need. Through this, you will not take or consume much more time to know what direction your practice could go for. Through community service, you may get your own dental practice and you designed it or planning it to provide implantology service, implant treatments, to provide machine restorations, okay? But when you are melted with your community through different community services, you may discover that the condition is not like you imagined. The condition they needs much more simpler treatments. The problem is, let us say, caries. Okay, caries is showing high index at this community. Then you will focus on how to provide them with programs that prevents this spread and extension of dental caries. Maybe this program be in a form of modifying their diet habits, your patient's diet habits, okay? Maybe in a form of teaching them prophylactic measures, okay? And they could feel your care about them, and this will drive you to success as soon as possible. This is what is meant by community service. It is not all about preventive programs. It is not all about undergraduates outreach program. Then comes research. When I was undergraduate, my dental school and all worldwide dental schools at this time didn't recognize the importance of research experience for undergraduate students. research was only limited for master degrees, enrolled students, and PhD, and other faculties. It was only limited to faculty members. But they discovered that how could your student, when they are graduated as a GB, could go forward and join continuous education program? How could they practice community service without they are aware about the updates in dentistry and dental research? Then comes the next question, okay? Did they have enough knowledge about how to do a research? Did they have enough knowledge about how to read a research? Did they have enough knowledge how to value and compare research from another? Okay. Did they know where they get their knowledge and trust it? How to trust this research and this is not. Okay. That's why most dental schools recognize the importance of research experience and involve it as essential requirements for graduation. Not only that, many organizations that provides license to practice dentistry requires research and research participants. Okay, but the only now problem is most of dentists and most of researchers, okay, think that the lab research, in vitro quantitative research, is most important. Okay, while social science research is also fascinating and valuable. You could get a great ideas about social science research when you practice community service. Community service may drives you to research about problem, okay, in a scientific way whenever you have the scientific basics to perform a research or to participate a research. Finally, building relations. Building relations in dental profession, okay, is not about connecting with other, such as your patients, okay, but also their families and the community as a whole. Okay, dentists are able to connect with and help people different from themselves and make their patients feel comfortable during treatment. It's simple as we mentioned before. Put yourself in their shoes, okay, and deal with them as the most valuable God creature, which is human being. Okay, when you discover this fact, then you could build a good relation with them. Okay, interact with patient one on one. Okay, or interaction with patients one on one. Okay, makes dentistry as an intimate profession. This is the difference between dentistry and the other healthcare services, because you spend much more time with your patient, not only in one visit but in multiple visits, and this is also build your repetition. This is also let you measure and assess the effectiveness of the other 11 competencies. It's the build the relation between you and your people or your patients. Then comes, what are dentistry career options? Also the same. About 30 to 40 years old, it was told that, okay, um, you are graduated from dental school, then you are a dentist. A dentist in a hospital, governmental one. Okay, this was the basic. This was the default. But actually, you could go for multiple options now available for dental graduates and are now involved under dentistry career. We now will focus only about healthcare providers, okay? But you could go for another services even if you are graduated for dental school, you may have opportunity to just little shift your career to be an advisor for dental companies, okay, dental material companies, okay, sales, preparing conferences and webinars in dentistry, okay. There are too many options now, but in our topic we are focusing now on healthcare providing through dentistry, which could be number one, according to American Dental Association, ranks the dental health care providers, okay, career options into six, which are private practice, academic dentistry, public health dentistry, research, international healthcare, hospital dentistry. Let me clarify something. 20 to 30 years old and in certain countries worldwide, still up till now, hospital dentistry was number one, okay, especially when you are hired in governmental hospital. That means that, okay, you have a fixed salary, you are in a safe financial condition, financial risk is minimal, okay, as you get a salary, you have fixed time to work, okay, from say 8 o'clock up to 4 o'clock p.m., okay, you are a fixed time for weekly vacations and for annual vacations. That's why it is considered as, if you remember what we discussed before, you are already jailed in your comfort zone. Okay? And most of dentists who joined this career option, okay, I spoke about the old fashioned one, okay, are still freezed in the same scientific point without any continuous education. But now it is changing. Now they asked the hospital, governmental hospitals, and all of these organizations, okay, asking their dentist and their healthcare provider for annual continuous education or regular continuous education. They should submit certificates, and they should transmit their experience to their colleagues. Okay. Previously, also 20 to 30 years ago, private practice was the least one. Now it is number one. Why it is number one? Simply it provides you freedom to go forward scientifically, financially, and from all points of view. But this is not absolute freedom. It should be controlled by ministers of health, okay, or whatever the organization governs this, and according to a definite law of practicing dentistry. Let us discuss much more details, the difference between them. Private practice, where dentists work either in a solo private practice or in partnership with dentists, okay? But the majority of private practitioners own their practices now. It is common in dentistry now. Either it is a solo clinic or it is a polyclinic that provides multiple services, okay, hiring different dental specialists in different providing different treatments, and this is also according to what you are assessing in your community service, and directs you to provide what service, okay, you could provide your patients. Then coming number two, academic dentistry. It's like me, this is my interest, okay? An academic dentistry career combines teaching, research, community service, and patient care, okay? Most of faculty members work in an intellectual, simulating, and existing academic environment, okay? The career opportunity for academic dentists are still excellent at this time because it covers much more areas if you are interested in teaching, research, community service, and patient care. Okay. Public health dentistry. It focuses on community settings rather than private practice, promoting dental health, developing health policies, and preventing diseases are the major roles of public health dentists. Okay, numerous opportunities exist in research and teaching with public health dentistry. It's an amazing specialty and amazing career option because you are in direct contact with population, in direct contact with their problems, and you will have much more ideas about research and how to solve their problems. This career improves and at the same time requires communication skills at higher level. Then you may join a research center. Research careers offer opportunities to generate new knowledge and be on the cutting edge of scientific discoveries that ultimately impact patient care. Okay, they are always in contact with dental practitioners. They are always assessing the problems in performing definite treatment or in practicing definite way of applying material or whatever the techniques. Okay, they are assessing and measuring the problems and trying to solve it, okay, in a way or another through a research. Okay, these researchers previously was focusing only on techniques, materials, procedures, complications of different treatment. But now also these researchers are aiming to improving patient cares, including not only lasers in surgery, implants to replace damaged bone, computerized radiography, which are the most updated dental treatments using digital components and also using artificial intelligence, but also these researchers now are focusing on how to communicate with your patient, okay, as a human being. This is the importance of introducing social sciences in our dental career and in dental programs for undergraduates. Okay, this could be practiced either in a research center, okay, with federal facilities, or mostly in faculties and universities, dental schools. A career in research requires an advanced degree or additional training beyond the dental degree as a dental practitioner. It could be international healthcare. Dentists provide services to population abroad, work for such agencies as WHO, UNESCO, FAO, all of these organizations providing international healthcare. It is similar that, let me give you an example, the management, generalized global management and the instructions set by WHO for managing the pandemic of COVID-19. Okay, this is a much broader community service, a much broader preventive dentistry. Okay, many dentists volunteer to bring dentistry to aid people in third worlds and countries arranged and set by WHO or UNESCO. Okay. Lastly, hospital dentistry. Hospital dentistry treat patients with medical conditions and disabilities alongside physician colleagues, often in operating rooms and emergency departments. Okay, hospital dentists usually have a strong interest in medicine and collaborative care and have spent a year or more training in a hospital-based setting after dental school. Mostly, they are interested in either dental surgery or pedodontics that requires mainly unconscious sedation or requires to be working in OR. Okay. Then comes, let me identify what is practice management. First of all, let us define management. Management could be defined to be in charge of people or an organization, to succeed in doing something, able to cope despite difficulties, to control the use of money and other resources. All of these definitions are right. It differs according to what's your career and where and when you are practicing management. But the most descriptive terminology is getting things done through other people. This is what is meant by management. Okay? Management is not about working by yourself, but it is about to be a leader, not a boss. There is a great difference. Boss gives orders, but leader did not give order. Leader guiding people to perform exactly and perfectly what had been planned, and these plans are approved by all the participants in it. Okay, this is the leader. This is the mean of getting things done through other people's. It is not the meaning of boss, it is the meaning of leader. Okay, that's why you can see that the owner and or manager of a dental practice, you will need to be able to do all the previously mentioned. Okay, how he should be a great leader. By the way, if you Google what is leadership or what is it describes leader, the best definition, the one who is directing from front and guiding from front and at the same time pushing from the back. Okay, this is the leader. Be successful despite the occasional difficulties and be an accomplished controller. This is the manager. The manager could be the owner, okay, or could be a different person. This is a talent and a science at the same time. It's now is considered as art and science. It's not only a talent, okay? However, if you want people to do what you want them to do and do it well, you are going to have to be an excellent communicator. This is the difference between boss and leader. Communication. Okay? That's why management is not just about telling people what to do and or how to do it. That might work in the short term. But if you are going to build long-term business, long-term successful business, you also need to build a long-term team, which is based mainly on communication. That's why the heart of every excellently managed business, regardless it is a dental practice or not, is excellent communication. That's why the foundation of a successful practice is a great team, and this great team based mainly on communication. Let us continue. Okay, management is not a black art, but like all disciplines, it has its own language. That's why planning is important when you are considered management. Management is equivalent to planning. And your basic simple stages includes number one, planning. Decide on a particular course of action to achieve a desired result. Then coming organizing. Organizing means you gather together all of the resources that will be needed to achieve the result. Then coming implementation. Implementation then it includes job description to each one, okay, and how to get each one to go work together smoothly and to the best of their ability as part of a team. All of these could achieve your goal, but how could you assess that you are achieving your goal? Then comes most importantly is a controlling phase where you monitor and review your progress. just to spot where is the error before it becomes a great mistake and you could correct your plan accordingly. Okay? Your controlling phase is just for put everything in its right place and correct errors immediately. Otherwise, you will not achieve your goals and you will waste your time, effort, and money. Okay? This is no difference to process you go through tens of times a day when you treat your patients. It is similar that treatment planning. Treatment planning including gathering data, كويس. This is the planning, organizing, integrating your data, then coming implementation. You are implementing your treatment plan and having definite stops after each phase to assess the success of your treatment plan. It is similar, but instead of treatment planning your patients, you are treatment planning your practice, your life. And this is also called the loop of quality. Even when you are assessing your quality, you are planning how to assess, organizing your data, okay, implementing the assessment way, and then controlling or reviewing phase. You should have definite spots in every item you are practicing in your life. This is your quality loop that performs or ensures that you are achieving your goals. Then, to learn to be a manager. Okay, how to learn to be a manager, and this will be the aim of our course. To learn to be a manager, okay, it is just important as acquiring your practice is knowing what to do with it once you have ownership. It's easy to own a practice, but you should think about what you have to do when you are the owner of a practice. The practice is not going to manage itself, nor are the staff going to recruit and train themselves. That's why it is important that you should have the necessary management and leadership skills before you become a practice owner, not after. How many young, even if not so young, dentists become a practice owner having had little, if any, managing experience, and they suffer too much troubles to run their practice until they reach their success. Okay, then to know what is the basics of management, it is a way or another to save time, effort, and money when you are going in your journey to success. You wouldn't dream of practicing dentistry without having first been fully trained. So why become a manager without first gaining the necessary knowledge and experience? Let me show you an example of a successful manager, not only in dental practice but even in his life as a dentist. This is Michael Abba. Michael Abba, if you read carefully this brochure, you could note that he's an American dentist having a dental practice at New York, okay, but at the same time having another practice in different countries and in different cities, including Dubai. Okay, he's a specialist in aesthetic dentistry. He is graduated in 2003. He's just young as 47. He is born in 1977. Now he's branding a new product with his name, Abba White Dew. Okay, because he already have a good plan, have practice with sufficient management knowledge, and had practice management that achieved and satisfy his passion and goals. That's why what you what do you need to know about management? You need to know about the practice of management in general, then specifically dental practice management, how to manage people. Okay, this is the most important one because people includes patients and employees, clinicians. All of these are people. You are should know how to deal with them, how to manage all kinds of resources, and how to manage money. That's why in your journey you should focus on management of patients and management of business. We only focus on management of patients in terms of treatment planning and how to perform treatment. But management of business includes much more aspects and terms rather than just a treatment plan. That's why management of business includes or involves knowing how to manage employee, which includes associates, hygienists, therapists, treatment coordinators, receptionists, and people doing your lab work, which are dental technicians, okay, and maybe the manager himself, okay. You should know how to manage your resources of all kinds, how to manage your financial and working budgets, okay. All of these you should know, okay. Some of the commonest mistakes people make when they set up a new practice in general, that they failing to thoroughly research the market beforehand. That's why I tell you before that most of dentists, okay, just having a dental practice, okay, and just having dreams about providing implant services, about providing digital restorations, okay, but they didn't search the market if it is in need for these or not. Otherwise, you are wasting your money, okay. The other, not having a high quality business plan. They didn't plan for the business, they just own a practice, okay, without any planning, either business, marketing, or financial plan. Okay, just open it. Okay, not listening for professional advisors. You should listen and ask for advising. You should get a mentor who advised you about the market. Okay, they setting their site too high in terms of location, size of premises, or quality and quantity of fixtures and fittings. This is what I asked you or tell you now. Okay, maybe it's not about the dental service you are providing, maybe about the decoration, maybe about uh, the number of clinics in your practice, okay, maybe about um, the fixtures, okay. All of these may be not suitable to either your quality as a dentist or the quality of service you are providing, or maybe not suitable for the location and the population you are within. Also, over investing in fixed assets and not keeping cash back to cover running costs. Okay, this is another mistake. Failing to employ the right people. Okay, just depending on your friends. Okay, this is a wrong concept, and that's why uh, one of the most important competencies now is to have a judgment skills and negotiation skills. And coming lastly, not learning how to be a manager beforehand. It is not about you should join or enroll in a course. At least now everything is available online and you could Google and upload much more than you could imagine, textbooks, lectures, PDFs, articles, or whatever you want, okay, about dental practice management. It's easy to get this knowledge now. But you should hold this thought. Failure to research and plan does not necessarily mean your practice will fail. It might mean that it takes longer time to success. That's why you should have a plan. Okay, you should research too much and read too much about practice management in order to save your time, your money, and your effort. Let me give you final example. Those are distinguished pioneers and leaders in business. Henry Ford, okay, he's the owner of Ford car companies, okay. Steve Jobs, okay, the owner of Apple, okay. Elon Musk for Tesla cars and PayPal. All of these didn't dream of making or earning money. They dreamed of changing the future for the better. But actually, they got the money because they were right. This is the same as Michael Abba. Michael Abba dreams for better future for his patients and for himself. That's why he is now okay earning money and branding for a product with his name, like movie stars. Okay, he's now a dental star at a very young age. Okay, finally, those are the textbooks I used. Okay, and please feel free to ask me as your questions are welcomed 24/7. You could ask me by commenting to this video and I will reply to you as soon as possible. Also, you could email me and I will also reply to you as soon as possible. Finally, I would like to thank you for assigning this time to listen to me. Goodbye until we meet again. Thank you, Yasser Wasifi.